This is KPPQ LP Ventura, 104.1 FM, and we're in the Women's Room, where we appreciate and support each other. I'm your host, Kathleen Good. Today's guest is Julie Mickelberry, Vice President of Community Engagement for Planned Parenthood, California Central Coast, a provider of reproductive health care. Hi, Julie.
Hi there. Thanks for having me today.
Oh, so happy to have you here so you can tell people and help them understand what Planned Parenthood does. Could you start by telling us a little about yourself and what you do at this organization?
Sure, I'd be happy to. Well, I am actually based in Santa Barbara. Our headquarters for Planned Parenthood California Central Coast are located there. We have 5 health centers along the Central Coast. We have one in San Luis Obispo, Santa Maria, Santa Barbara, our Ventura Health Center, of course, and Thousand Oaks. And I essentially, in my role as the Community Engagement Vice President, oversee our public relations and our education programs, as well as our public policy efforts.
And what do you mean by public policy?
Well, part of our work is really protecting access to the care that women and men receive at Planned Parenthood, and to make sure that there are laws in place that are progressive and allow for Planned Parenthood to do the important reproductive health care work that we do in the community.
So you do provide services for men as well?
Absolutely. Men are actually our fastest growing group that we provide services to. And, we see men for a variety of reasons: sexually transmitted infection testing and treatment, general checkups. We're offering PEP and PrEP now, and syphilis treatment. So there are a lot of different reasons why men would choose Planned Parenthood as their trusted provider.
PEP and PrEP, could you explain that a little?
Sure. PrEP is a regimen that an individual can take to prevent reduce the risk of contracting HIV.
Oh.
And PEP is a treatment that can be taken shortly after an individual believes that they may have been exposed to HIV in hopes of preventing development of the actual virus. It's an important service to be able to provide for our community.
Yeah. So is there an affiliate here in Ventura?
Actually, the health center in Ventura is a part of the Planned Parenthood California Central Coast affiliate.
So, but there is actually an office here.
Oh, absolutely.
That people can
yes.
go to.
We see thousands of individuals at our Ventura Health Center for a variety of different reasons, whether coming in for just a simple well woman checkup and pap smear to do a cervical cancer screening, or coming in for breast exams or birth control methods or sexually transmitted infection testing and treatment. Those are just a few of the services that we provide here in Ventura.
Wow, a lot of services. Now, is Planned Parenthood a private company?
Planned Parenthood is a nonprofit healthcare organization committed to providing reproductive healthcare services to everyone in the community that needs them.
Now, how many people actually receive services from Planned Parenthood?
Throughout our affiliate, we actually serve about 36,000 patients each year.
Wow. And that's just California Central Coast.
And that's just our affiliate. And we're one of 7 in the state of California.
Oh, wow. And then what about nationwide?
Nationwide, we see roughly 2.5 million people.
Oh, my goodness.
Yes.
So you've mentioned a few types of services that you did. Are there any others?
Let's see. We talked to you about sexually transmitted infection testing and treatment and birth control methods. We provide Plan B, which is commonly referred to as the morning after pill. When men and women come in for their well woman or regular checkup, there also are screenings for blood pressure and blood sugar. So we're able to refer folks out if we identify things that need to be followed up on. We do breast and cervical cancer screenings and syphilis treatment. So it really depends on what the individual needs. And if we identify something that that we cannot treat. We are on the front line of making sure that, people are able to access the care that they need. It's interesting. For a lot of women, a visit to their family planning provider is often their only visit. And so when, women come in to Planned Parenthood, it's sometimes the only healthcare visit they've had in the year. And so we're able to sort of identify other issues that may need to be treated. And we work closely with, our providers in the community to make sure that everyone who comes in through our doors is getting the quality care that they deserve.
So you mentioned that it might be the only visit they have in the year. So many of the people who come to Planned Parenthood probably don't have regular health care insurance.
Many of them do. We actually, the vast majority of the patients that come in and visit our health centers along the Central Coast are coming in either through the FAMPAC program, which is the state's family planning waiver, or they're coming in because they qualify for Medi-Cal. And so they're able to access care through that insurance program. And then quite a few actually have private insurance, and they're able to access care through, the regular Blue Cross Blue Shield insurance carriers, the private carriers. And I think that's why when we think about the recent attacks on Planned Parenthood and the efforts to defund, it's critically important to really understand what that means.
Okay. Well, my next question, I can already see why, but what motivates you to work for Planned Parenthood?
Gosh, I think it's seeing the difference that we make in people's lives. I saw that firsthand early on when I was a college student volunteering for Planned Parenthood, and I had the opportunity to be a part of what was a patient escort program at that time, and being able to meet women and men coming into the health center and kind of ushering them past through protesters who really didn't understand why most of our patients were there and didn't understand what Planned Parenthood really does and the critical role we play in providing basic health care to our community. So it started there, and then, I started working full-time in the public affairs department in 2003, and I've been with Planned Parenthood in some capacity ever since.
So you mentioned escorting people in. Now, is this a usual thing that at the offices there are generally protesters?
There are, on some days, there are protesters that come out and try to talk to the folks that are coming in to visit our health centers, and most of them are providing misleading information or trying to deter them from visiting our health centers, or trying to shame women into making very personal medical decisions. I think we're lucky in California in some respect, in terms of the numbers that we see and the level of hostility that we face. But there are still people out there who really want to stop, women and men from accessing care at Planned Parenthood.
So there's an assumption that people are going there for abortions and not just for many other reproductive type services.
I think that's part of it. I think the other part is that there are a small but very vocal group in our country that really want to shut Planned Parenthood down. And whether that's because they don't agree with abortion or don't agree with women even having access to birth control or don't want to empower women, I think everyone sort of has their own values and beliefs. But what Planned Parenthood does is really meet people where they are and understand that, people need critically important services to be able to lead the lives that they want. And family planning, access to birth control is such an important part of being able to really reach your full potential.
Right. So how long has Planned Parenthood been around?
We're actually celebrating our 100th anniversary.
Oh, 100th.
Yes.
Oh, so it was 1916.
Yes.
Yeah. Oh, wow.
So our local affiliate was established 52 years ago.
Now, I noticed while I was doing some research for our interview, dozens of national polls about the favorability of Planned Parenthood. Could you talk about some of these polls?
Well, there have been 16 national polls conducted since the first congressional attempt to defund Planned Parenthood, which was back in 2015. All of them show strong support for Planned Parenthood and incredible strong opposition to dangerous policies targeting Planned Parenthood. So the majority of Americans, really support the services that are provided at Planned Parenthood, have, firsthand or know folks who have come into a Planned Parenthood and received a cancer screening or, a pregnancy test or a birth control method. I mean, they know firsthand what Planned Parenthood does for so many in our country, for that 2.5 million people who visit Planned Parenthood's health centers. And so they strongly support the services, and they strongly support funding for Planned Parenthood services.
So if the majority of Americans support Planned Parenthood, why, in your view, do legislators want to cut this funding?
I think that's a really good question, and one that everyone should be asking their members of Congress, honestly. The fact of the matter is federal funding for our services is kind of, it's essential to women's health. And I kind of want to back up for just a moment here, if you don't mind.
No, go ahead.
So when we talk about defunding Planned Parenthood, I kind of want to illustrate what that means.
Okay.
It's not as though Planned Parenthood has a line item in the federal budget and they're suddenly going to strike it out and will no longer receive a big grant that's awarded to, an organization.
So it's not a grant.
It's not a grant. So the way that Planned Parenthood health centers treat patients and see patients is through a reimbursement process. So regardless of whether their patient is coming in with Blue Shield health insurance or Medi-Cal, we have to provide a service to that patient, and then we get reimbursement from the payer to be able to provide those services.
So in California, the payer is?
The payer is Gold Coast locally, and that's a Medi-Cal program. So it's an HMO that carries a managed care organization that carries the funds and allocates the funds. So when we provide the service, we actually bill for reimbursement.
I see.
So
it's like a regular
insurance program.
Yeah.
Absolutely. And so when Congress says that they want to defund Planned Parenthood, what they're really saying is they don't want people to be able to access care through Medicaid at Planned Parenthood services or at Planned Parenthood health centers, excuse me. So it's not that we essentially will be defunded. It just means people will not be able to visit us if they are on public insurance programs like Medi-Cal.
About contraceptives and not being able to get them. Are they terribly expensive if you buy on the open market?
I think yes, they can be. And it just really depends on what kind of method.
Like the pill, for example.
The pill is more reasonable than the other.
Oh, is it?
There are longer acting contraceptive methods that many women have decided to pursue because you don't have to take it every day. They're more effective. For instance, the IUD. Now under Obamacare or ACA is available without a copay, right? It's covered as part of the birth control benefit.
Right.
If that were to go away, that would cost hundreds of dollars for an IUD.
Per year or per month?
It depends on what type, because some IUDs or IUCs are 3 years, some are 8. It just really depends on how long acting they are. It would be they are incredibly expensive. So like I said, it's, the statistics, it's 33 to 40% of the healthcare costs for women when they're paying for contraceptives.
33%? That's quite a large percentage.
Yes.
Yeah. And some of the people who come probably couldn't afford that.
Right.
Or they would have to use an alternative method.
Absolutely. And just getting back to the Congress's attempt to defund Planned Parenthood, our California affiliates see almost 800, actually more than 800,000 patients each year. So, and a large majority of the patients that we see are accessing care through FAMPAC, which is a federal program, or Medi-Cal, which is a federal program. If Congress were successful, the safety net in California, and this is according to the California Primary Care Association, is not able to take care of the patients that we can't see. There's just not enough providers.
Oh.
And so there's a real risk here.
Right.
At eliminating access to actual care. And we're talking about life-saving cancer screenings and helping women prevent cervical cancer and prevent breast cancer, and to be able to access the care that so many need and deserve, just as a basic right.
Right, all of which are a big cost to society. If someone has cancer and needs treatment, that gets added into, how much the insurance companies are going to be willing to cover.
And prevention is so key. And early prevention, you're right, saves a lot of money in the long run.
Not to mention quality of life. Okay, we're going to take a little break here. This is KPPQ LP Ventura, 104.1 FM, and we're in the Women's Room. I'm your host, Kathleen Good. Today's guest is Julie Mickelberry, Vice President of Communications for Planned Parenthood, California Central Coast, a provider of reproductive health care. I have heard, because it's been in the news a lot, that pro-lifers want to cut contraception from health care because they do not want to pay for someone else's birth control or abortion when they don't believe in it because of their religious principles. Could you comment on this?
This is an issue that I think was elevated when the ACA introduced the contraceptive benefit that allowed...
Could you tell our listeners what the ACA is?
The Affordable Care Act.
Oh, okay.
Within the ACA, birth control was made available at no cost, so without copay. And it was also required that insurance and employers really provide it as an option for their employees. There was a lot of resistance, and there was a negotiation that came to place that, those that had an exemption, there were a few that could be exempt, still needed to allow their employees to access care through a third party. So I would say that this is an issue that has been resolved, and that, paramount is obviously an individual's right to be able to access the care that they need to stay healthy. I think that it's critically important that we don't place barriers to access to birth control.
If they do defund Planned Parenthood and cut out contraceptive care or reproductive care, who would be hurt the most if Congress does pass this law?
Those that are underinsured, uninsured, those that are accessing care through the Medicaid program would be most effective, because they would not be able to receive care at their provider of choice.
Okay.
In many of which is Planned Parenthood. In California, that's 800,000 women and men who seek reproductive health care services at our health centers.
And is this along, economic, racial lines?
Sure. Yeah. And within our affiliate, about 70% of the patients that we see are at or below the poverty level. So this would have a huge impact to the patients. And right now, we're trying to assess locally, if there are providers in the area that could, really see the patients who need this care, if indeed they were not able to access care at a Planned Parenthood.
So you're actually seeking out alternatives for them.
We want to do an analysis to find out. We know that California, the safety net cannot really see all of the patients that would be turned away if they were not able to use their Medi-Cal insurance at Planned Parenthood. So it would be devastating for women. Especially in rural areas where Planned Parenthood is often the only provider that is providing, access to cervical cancer screenings, birth control methods, STI testing and treatment. these are critically important services for women.
So do you think Congress is aware of, how many people are going to be, particularly women, will be left out in the cold if they cut funding?
Well, this is not a new issue for Congress.
Oh.
Last session, they attempted to defund Planned Parenthood. I believe it was 9 times. They were successful in getting a bill all the way to the president's desk in 2015.
Mm-hmm.
Planned Parenthood, our supporters, our patients, have been sharing stories, giving information, educating leadership about what this really means for people who come through our doors, what it means for, the woman who's not going to be able to get the cervical cancer screening that she needs, or the birth control pack that she needs, or the morning after pill. We have shared those stories. We are ready for them to listen because, there are 1 in 5 women who have come into Planned Parenthood and have trusted Planned Parenthood to be their reproductive health care provider, and losing a trusted provider
right.
is devastating. It will be devastating.
Right. So do taxpayers actually pay for free birth control under the Affordable Care Act?
Well, through Medicaid expansion, they would. It's a federally funded program through
right.
tax dollars. So, there are programs that we all pay into.
Right.
Whether it's having police on the street or, programs for our veterans. We also pay for health care for folks who are underserved.
Uh-huh.
And part of that health care, because of the Affordable Care Act, birth control is available without copay.
Uh-huh. So does Planned Parenthood also rely on public support, perhaps private donations?
Yes, we are very lucky along the Central Coast to have very generous supporters who help through supporting our education programs and providing services, our assistance fund, foundations, individuals contribute generously.
Oh, good. So the Republican Congress also vows to cut funding for Planned Parenthood, and appointees to the Supreme Court will most likely be ultra-conservative under a Republican administration, thus opening up opportunity for test cases to repeal Roe v. Wade. Would you explain what the Roe v. Wade legislation does for women?
Essentially, Roe v. Wade is the decision that the Supreme Court made in 1973 that confirmed that the right to privacy also includes the right to make personal pregnancy decisions, the right to safe and legal abortion services
right.
without government interference.
Okay. Planned Parenthood is concerned about reproductive rights for men, and you've mentioned for women. I'm sorry, but you've mentioned that you provide services for men. Now, what was the percentage of men who receive services from your organization?
I believe it's about 11% right now, but it is growing. It's the fastest growing group of patients for Planned Parenthood. Yes.
Oh,
yes.
Okay. Now, what would it mean for women if Roe v. Wade is overturned, and why does this concern you?
I think that obviously access to safe and legal abortion is an important healthcare service.
Uh-huh.
Being able to go into a provider that you trust, that has the training and compassion to be able to give you the information and options to make decisions about your pregnancy is crucial.
Mm-hmm.
And 1 in 3 women actually at some point in their lives will have had an abortion. So this is a relatively common procedure. Roe gives people the ability to be able to access care safely. And even though Roe is in place, I would say, however,
right.
There are states in our country that have placed so many restrictions on abortion that it's nearly inaccessible. And what's happening in the places where there are bans on particular procedures or targeted regulations on providers, there are fewer and fewer providers of abortion. So there's really an undue burden placed on women needing access to safe legal abortion. You look at some place like Texas where you have to drive hundreds and hundreds of miles just to be able to access care.
Right.
And there are all these barriers throughout the state. So even though Roe is still in place, and we're coming upon the 44th anniversary of the Roe v. Wade decision, actually next weekend, it doesn't mean that it's accessible for everyone. The sheer cost of being able to access a safe legal abortion is onerous on a lot of women.
It really depends on where you live.
It really depends on your zip code. It really depends on where you live. It depends on how your economic situation. I mean, in 1976, the Hyde Amendment was passed. And it was challenged, but really went into effect in 1980. And the Hyde Amendment essentially prevents any federal funds for supporting or paying for, services for abortion services.
So it really is at the state level.
Right. Yeah. Exactly. Which kind of leads me back to the discussion about defunding. And I think it's kind of interesting that, one of the reasons why some politicians want to cut off funding for Planned Parenthood or cut Planned Parenthood out of the Medicaid program is because we provide abortion services. But what they don't realize is that none of those federal funds actually go towards abortion services. Those funds, the reimbursement we're getting from the federal government, is supporting things like birth control methods, cervical cancer screenings, breast cancer screenings, sexually transmitted infection and testing and treatment, which actually is a preventive measure to make sure that folks are able to preserve their fertility and go on to decide if they want to become a parent. So these are crucial, basic preventive healthcare services that the members of Congress that are leading this effort want to prevent people from accessing at Planned Parenthood.
So what percentage of services are actually abortions?
With our affiliate, it's 5%.
5%.
5%.
Yeah, that's very low.
Yes.
Compared to everything else you do. So does Planned Parenthood consider abortion a form of birth control?
Planned Parenthood, we are committed to providing every individual who walks through our door with the information, the education, the health services that they need to, prevent unintended pregnancy, first and foremost. But we do believe strongly that women should have access to safe and legal abortion services and that they should be treated without judgment. We don't walk in anybody else's shoes. We believe that that women should be trusted to be able to make the decisions that are right for them. And Planned Parenthood's role in that is to be able to provide information and education and all the available options so women can feel empowered to take control over their lives.
Something that is only really recent, really within the last 100 years, that women have had control over their lives without danger, perhaps. So if, all of these defunding and Roe v. Wade is repealed, this will mean that abortion will go underground.
That's a big risk. That's why these measures and attacks are so dangerous, because they really they put women's lives at risk. We want to be able to participate in a health system and a country that really values and trusts women and individuals to be able to make the best medical care decisions that are right for them.
And really, they are the only ones who can make decisions.
They are the only ones that can make it.
Yes.
Right?
So are you ever fearful?
Fearful's not the right word. I'm committed. I'm determined. I really truly believe in the work that Planned Parenthood does. And I've seen the way that visiting Planned Parenthood and accessing quality care has changed so many lives and made them better. And so fearful, no, I feel determined.
Okay, well, we'll leave it at that note. This is KPPQ LP Ventura, 104.1 FM, and we're in the Women's Room, where we appreciate and support each other. I'm your host, Kathleen Good. Today's guest has been Julie Mickelberry, Vice President of Communications for Planned Parenthood, California Central Coast. Thank you, Julie, and we'd love to have you back again.
I'd love to come back. Thank you.